This is RegisteredNurseRN.com, and today we're going to cover nurse midwife salary. Now, nurse midwives often earn a very competitive salary due to the skills and high level of education that they receive. In fact, some nurse midwives with years of experience can sometimes earn more than an entry-level primary care doctor, so that's usually pretty impressive. Midwives earn a very high salary in the nursing field, along with the nurse practitioners and CRNAs, and those tend to be some of the highest salary earners among nurses. So the income level you will receive as a nurse midwife, first of all, will depend on a few factors such as experience, job demand, cost of living, and the employment setting you choose. Those with years of experience, again, will earn more than an entry-level midwife. Also, those working in an area that experiences really high demand for those midwife skills will also offer higher wages than those areas who maybe don't have such a high demand for the midwifery profession. The cost of living is also very important, as nurses in highly populated cities will typically earn more of a higher salary than nurses in a lower population. And finally, the employment setting can make a large difference as well. A nurse income can vary depending on whether or not they work in a hospital or a private practice or a not-for-profit or other healthcare agency. So that's something that you want to keep in mind when we talk about these salary figures. So, okay. First of all, what are the salary figures? Well, the median annual salary for a certified nurse midwife working in the United States is $90,119. And again, that's only the median income, which means the middle. When you take all the salary data and you chart it out, it's right in the middle, is about $90,000. Some may earn much less and some may earn much more. So, that's always important to keep in mind. The lowest 10 to 20% of the nurse midwives earned annual wages or salaries of about $76,000 to $83,000. So that's on the lower end of the spectrum. Again, it could even be a little lower if you are entry level and you work in a really small populated town. It could even be a little less, but the lower 10%, because you do have so much education and specific skills that are needed, you're looking at about $76,000 or so on the lower 10% of the spectrum. The middle 50%, again, was about $83,000 to $98,000. So again, that hits close to that median figure we talked about. The top 75% to 90%, that's the top wage earners, earned about $98,000 to $105,000 annually. So again, that's quite a significant salary, very impressive. And again, considering that you can become a registered nurse, work for a while, go back and get your nurse midwife certification, and you can do that in usually 2 to 3 years with a master's program, and you can earn just about as much as a doctor. So that's pretty interesting. The highest salaries were in the following states: Massachusetts, Connecticut, New York, Alaska, Delaware, Ohio, Maryland, New Jersey, Colorado, and Illinois. So those offered the highest salary to midwives at the time when we viewed this data. Many other factors affect the salary in which a nurse midwife can earn in other locations. And again, we talked about the employment setting, and that's important to consider. It's important to note that most midwives will earn a salary-based income. And what we mean by that is that since you're typically not paid an hourly wage, you'll earn the same amount each year regardless of how many hours you work. That's sort of the downside to having a salary position, because, you can work 50 hours a week sometimes and your income's not really going to go up as if you had, say, an hourly wage where the more hours you work, the more you earn. So that's the downside of earning a salary, but the good side is, even if you work a little less, you'll still earn that nice figure. And even though that the data that we have wasn't breaking down in wage format, we can get the approximate hourly wage for a nurse midwife. So if you take the median salary of $90,119, you could divide that by 2,200 hours. That's 40 hours a week, and there's 55 weeks in a year. So, and that will give you an hourly wage of somewhere around $40.96. So again, if you kind of want to see the approximate hourly wage you could earn if you did find a wage position, you could take some of those figures that we mentioned there on our website, and you could just plug the 2,200, divide them by 2,200 hours to see the approximate hourly wage. The nurses, the midwife nursing is one of the best areas of nursing to enter because, again, you're going to make a very competitive salary. Nurses tend to love working with children, and we have an article on what nurse midwives do if you want to learn more information about that. But labor delivery nurses, nurse midwives, these tend to be very high demand areas of nursing. They love working with children in most cases. It's got a very low turnover rate. So it's something that if you're interested in it, we have some information on our website. As far as the job outlook, a very promising future lies ahead for most midwives. It has one of the best opportunities, as nursing in general is one of the fastest growing of all occupations across the board according to the BLS. So through 2020, we expect a large increase in the number of nurses, and midwives are definitely going to be in high demand. And again, you work with pregnant women, you'll work with delivering children, and they can work alongside gynecologists and obstetricians and so forth. Midwifery is a very interesting career. We have quite a few articles on our website about it, and we'll be posting more information over time. But if you're interested in nursing at all, you want more information on how to become a midwife or anything else, we would like to invite you to our website, registerednurseryan.com. If you're watching this on YouTube, you can also subscribe to our videos or check the video description, and you'll find the link back to our website. So thank you so much for watching, and have a great day.